Hello, Miss Johnson. My name's Rebecca. I'm a physician's associate and I'm here to help you today. Okay, so can I please ask the reason for your visit? Okay, so you've been experiencing pain and swelling in your big toe. Has it felt hot or cold at all? Hot, okay. Have you experienced any high temperatures or chills, or have you been feeling generally unwell for the last couple of days? Okay, so you've been feeling fine. Okay, so would you mind if I take your temperature first of all and then take a look at your foot? Thank you. Okay, so your temperature is perfectly fine, so we can rule out any signs of infection there. Okay, so whilst looking at your foot, I can see that the joint is inflamed, and so you can definitely see the swelling and see the difference between that foot and your other one there. Okay, and there's definitely redness around the joint as well. So have you been able to move your foot as normal? No, so walking is painful and wearing shoes. Okay. So I just need to ask you a few questions about what you eat and drink, if that's okay, Miss Johnson. So do you eat a lot of red meat? About 3 to 4 times a week. Okay. So do you drink alcohol at all? Not really. Okay. So do you drink a lot of water during the day? No. Okay. So you appear to be a healthy weight. Do you like to keep active? You love the gym? Oh, that's excellent. Okay. So I see from your medical history that you've been taking water tablets for your blood pressure. Are you still taking these? Yeah. Okay. So what I do think you have is gout, which is a form of arthritis. Oh, your dad has this too. It is known to run in families. So gout is where there are high levels of uric acid in your blood, and this then leads to the formation of crystals which are accumulating in the joint of your big toe. That's what's causing the swelling and the pain and what's making it difficult to get your shoes on and walking. Okay, so flare-ups of gout usually last between 1 and 2 weeks, and then hopefully things should settle down again. However, unfortunately, these symptoms will come again. However, there are several ways we can try and stop that and prevent them being as severe as this time. Okay, so what I want to do first of all is send you for an x-ray just to make sure that the gout isn't advanced. And then in about a month's time, I want you to come back for a blood test. This will just measure the levels of serum uric acid. We can't do that at the moment, as whilst there's a flare-up, it's not going to give me any results. That's not going to indicate whether this is gout or not. But now the things you can do in the meantime to prevent the symptoms recurring or getting any worse. In first instance, we would advise that you reduce the amount of red meat that you eat, and also the high-fat dairy such as cheeses and heavy creams. Okay, we would also advise that you increase the amount of water you drink during the day as well. Okay, along with this, to help with the pain, is I'm going to prescribe you some anti-inflammatory medication, which will help. Have you taken ibuprofen before? Yeah. Have you had any problems whilst taking it? No. Wonderful. Okay. As well as these tablets, you can also help it by keeping the joint cool by applying ice packs like frozen peas, and also keeping it raised and well rested. Okay. So if the pain doesn't go away or it's not improving over the next 3 to 4 days after taking the ibuprofen, please do make another appointment and we'll be able to prescribe a steroid for you, and this should help take the pain down as well. Okay, do you have any questions at all? Okay, we can do further tests just to confirm definitely. There is a test we can do which involves taking some of the fluid out of the space in between the joints, synovial fluid, and then we'll be able to send that off and look at the crystals under the microscope. But that's not always completely conclusive. It's not always done in this clinic here. So we're just going to wait and see how you go before we do that, if that's okay. Okay, do you have any more questions at all? Okay, now I know I have given you a lot of information today, and I know it's quite difficult to remember it all. So I do have a patient's information leaflet here, and it's got all the do's and don'ts and top tips for managing gout, if that's okay. And then if you do have any further questions or you'd like any more information, please do give reception a call and we'll arrange another appointment. Is that okay? Well, thank you. Goodbye, Miss Johnson.